Hello friends, welcome back to ManpreetRN Talks. So today we are dividing into ARBs, the blood pressure meds which is ending in sartan like Losartan, Valsartan. So why are they safer than AC inhibitors for some patients? So what's one side effect you must never ignore? So let's break it down in a way that's quick, clear and NCLEX focused. So stay with me. So let's get started. ARBs, angiotensin II receptor blockers. So common ending suffix sartan. For example, losartan, valsartan, olmesartan. So mode of action, it is very simple and clear. ARBs basically blocks the angiotensin II receptor in the vascular smooth muscles. So this prevents vasoconstriction, like tightening of the blood vessels, and aldosterone release, which retains salt and water. So this all leads to vasodilation and that lead to lower the blood pressure and reduce fluid overload in the heart failure. So indication for the apps. So first, as you all know, it's hypertension. So especially when AC inhibitors cause a dry cough. So at that time we use apps. So and the heart failure to improve the cardiac output and reduce the fluid in post MI myocardial infarction. It basically protects the heart, the body in diabetic neuropathy, you used to give to protect the kidney and in stroke prevention, especially in high risk patients. So, key side effects for the NCLEX alert, you can remember for the NCLEX, basically is hyperkalemia. So, all the ARB, because ARBs reduce aldosterone, so it will, so ARBs, as you can, ARBs leads to reduce aldosterone, so which can less potassium excretion, so that can lead to increased potassium in the blood. So, as well as hypotension, dizziness, angioedema, but rare but serious. Is usually common with AC inhibitors. So no dry cough. So all the AC inhibitor cause dry cough, but ARBs do not increase bradykinin. So it cannot lead to dry cough. So as a replacement of the AC inhibitor, we give patient to ARBs. And the contraindication for the ARBs in pregnancy we cannot give up. So almost all the drugs they are contraindicated in the pregnancy, or we also give labetalol in the pregnancy. So renal artery stenosis and hyperkalemia. A patient is using AC inhibitor or potassium sparing diuretics, so spironolactone, because it can increase the potassium in the blood, which can lead to cardiac arrhythmia. So next is nursing responsibilities. So, as a nurse, when we give ARBs to a patient, what points we can keep in mind before giving medication to the patient? So, always check BP before giving medication. Hold if patient is hypotensive, systolic BP is less than 100 mm of Hg. Monitor potassium level because it can lead to hyperkalemia. So, avoid potassium rich foods such as bananas, oranges, salt, substitutes and monitor renal function test because it can lead to impair the kidney. So BUN and creatinine level is very important. So educate the patient about the signs of angioedema. As we have discussed above, angioedema is rare in the ARBs, but it is serious. So always tell the patient about the side effect of angioedema and avoid in the pregnancies. Always warn the woman of childbearing age. So you can comparison of AC inhibitors and ARMs. So you can remember suffix which is ending in pril, like they are AC inhibitors, and certain are ARP. So in dry cough, it is common with AC inhibitors. So when a patient is become having a dry cough, we used to change the AC inhibitor to the ARBs. So it is rare with the ARMs. Angioedema more frequent with AC inhibitors, but ARBs they have rare. But when it is having, it's very serious. So hyperkalemia, both the drugs they are cause hyperkalemia, and both the drugs are not used in pregnancy. So, NCLEX mnemonics, you can remember the apps word sartan. S spares bradykinin means it do not cause dry cough. Avoid in pregnancy. Are renal protective in diabetes. They take it without regard of meals. So we not we have to take with meals. A is angioedema is rare and no salt substitute because it can lead to increased potassium level. So that's all about ARBs. Slow. Next, we can do some practice questions. Question number one. A nurse is reviewing the medication list of a client newly prescribed Losartan. Which of the following findings should the nurse report to the healthcare provider? A. The client is taking potassium chloride supplements. B. The client has a history of seasonal allergies. C. The client reports occasional dizziness when standing. D. The client is taking a multivitamin daily. So, right answer is A, because patient is taking potassium chloride syrup, because it can lead to risk of hypothermia with so we should report to the healthcare provider. So B option is cut out because patient has history of seasonal allergy. We don't have any contact with this losartan. So C client reports occasional dizziness when standing. So word occasional. So just focus on the word occasional. That is not it is very that note will kill the patient. So D the patient is taking multivitamin. So that is no link with multivitamin and losartan. So right answer is A. Question number two. Which electrolyte imbalance should the nurse monitor in a patient when is taking an angiotensin II receptor blocker? So all it is hyperkalemia. So we have to monitor for the hyperkalemia because ARBs reduce aldosterone that can lead to potassium retention. Question number three. A pregnant client with chronic hypertension is prescribed losartan. So what is the priority action by the nurse? A. Teach the patient to take the medication with food, be notice sign for the signs of angioedema, notify the healthcare provider, and encourage fluid intake. So correct answer is C, notify to the healthcare provider because apps are contraindicated in the pregnancy due to risk of fetal harm. Question number four. Which statement by the client taking Valsartan indicate a need for further teaching? So further teaching means so all the which answer is false. So we have to choose that answer that is false. So A, I will avoid short substitute. That is right. B, I can stop this drug if my BP becomes normal. C, I will rise slowly to prevent dizziness. D. I will report any swelling of my face or lips. So, correct answer is B, means which is false. So, I can stop this drug if my BP becomes normal. Always remember antihypertensive drugs like ARBs and ACE inhibitors and other one should not be stopped abruptly. Will stop decrease day by day as ordered by the physician. So should not stop abruptly. So other answers are right. So question number five. A client is prescribed irbesartan. So which lab result is most important to monitor? So always all you know is potassium level. So A WBC count, that is not. B potassium level, yes. C HB level, not. D platelet count, no. So correct answer is B. So that's all about the arms. So if this video is helpful for you, give it a thumbs up and share it with your study group and with your friends. So don't forget to subscribe to ManpreetRN Talks for more NCLEX and OSCE or Norcet exam tips. So and in a comment section, tell me what drugs you want for the next. And until then, keep learning, keep growing, and good luck for future nurses. Thank you.